Here's a question that might surprise you. When you take a medication to lower your blood sugar, could it also affect your risk of a heart attack or stroke? Welcome to Science My Health, your channel for health and research information. Many people with type 2 diabetes take medications after metformin to control blood sugar, but not all of those drugs behave the same in the body. A large real-world study published in JAMA Network Open looked at whether three common diabetes medicines affect the risk of serious heart problems like heart attack, stroke, heart failure, or heart-related death. To understand why this matters, let's look at diabetes and heart risk. Type 2 diabetes doesn't just raise blood sugar, it also increases the risk of cardiovascular disease. High glucose levels can damage blood vessels and promote inflammation, setting the stage for heart attacks, strokes, and heart failure over time. So when doctors choose a diabetes medication, they don't just think about blood sugar. They also consider how a drug might affect your heart. In this study, researchers used health records from more than 48,000 adults with type 2 diabetes. Every person had started a second medication after metformin between 2014 and 2023 and had a moderate risk of heart disease. The medications were grouped into four categories: glipizide, glympyride, glyburide, all sulfonylureas, and a class called DPP-4 inhibitors. These groups were similar in age, sex, and basic health measures like blood sugar and cholesterol. The researchers followed these patients for about 3 years on average. Instead of looking at each heart event separately, they looked at a combined outcome called MACE-4. This stands for major cardiovascular events including heart attack, stroke, hospitalization for heart failure, or death from heart disease. This gives a fuller picture of how a medication may influence overall cardiovascular risk. So what did the study find? Overall, about 6.6% of people experienced at least one major cardiovascular event over the follow-up period. When comparing medications, the group taking DPP-4 inhibitors had a 5-year risk of about 8.1%, and glyburide had a similar risk at 8.4%. Glimepiride was a little higher at 8.6%, but the standout was glipizide, where the 5-year risk was about 9.1%. That difference matters. Compared with DPP-4 inhibitors, glipizide was associated with about a 1% absolute higher risk difference of major cardiovascular events over 5 years. The increases for glympyride and glyburide were smaller and less clear, meaning the evidence wasn't strong enough to say for sure they raised risk in the same way. In simple terms, here's what this means for patients. If you have type 2 diabetes and moderate heart risk, not all second-line medications may be equally safe for your heart. DPP-4 inhibitors appeared to have a somewhat lower risk of serious cardiovascular events compared with glipizide in this real-world large cohort study. That doesn't mean sulfonylureas are always bad, but it suggests that glipizide in particular might not be the best option for people who have also been diagnosed with heart issues. Doctors already monitor heart risk as part of diabetes care, but this adds new context. When you and your healthcare provider are deciding on a diabetes medication after metformin, it may be worth discussing your personal cardiovascular risk, whether alternatives like DPP-4 inhibitors could be appropriate, and how lifestyle changes, like diet and activity, fit into your overall plan. Medication choice always balances blood sugar control, side effects, cost, and long-term health goals. The bottom line? The study doesn't prove cause and effect for every individual, but it adds strong, real-world evidence that the choice of diabetes medicine can influence heart health. Like this video and subscribe to Science My Health for more easy-to-understand health research news.